Today dentistry is reached a different level. It is no more the primitive form of dentistry which was practiced earlier. It's come to a different level, and that's why dentistry is always linked to modern dentistry now. Modern dentistry because modern equipments, modern materials and the latest techniques have been employed to administer the best treatment for the patients. Today dentistry, unlike the olden days, has evolved, I would say, so that the patient who comes in to visit a dentist can get the best of dental treatment. Basically dentistry, earlier days, a dentist, a so-called dentist, he used to attend patients who needed extraction of tooth, root canal probably if he had to save it, maybe to fix a tooth, maybe to align the teeth also. But now it has come up to be branched better, and more specialists have come. If your tooth has to be saved using root canal method, it is generally treated by an endodontist, a root canal specialist. For the children, a different branch of children dentistry is started, which is known as pediatric dentistry. If a patient is required to have certain gum treatment, where the gums or the teeth, the tissue supporting the teeth is unhealthy, then a different branch of dentistry comes into place known as periodontology, and the specialist of that is known as periodontist. Similarly, if a patient is requiring braces for malaligned teeth or crooked teeth, then another specialist in dentistry, an orthodontist, comes into play. And again, if somebody requires replacement of a missing tooth, for example a bridge, a denture or a removable partial denture, or be it an implants also, there is another specialized dentistry known as prosthodontic dentistry or prosthodontics, where a prosthodontist plays an important role. Similarly, if there is any oral lesion where there is a kind of pre-malignancy or a potential malignant disorder which is seen in the mouth because of certain habits like tobacco, chewing, etc., then an oral pathologist comes into role with the help of an oral diagnostician, like an oral medicine. So basically dentistry, there are different forms. That is oral medicine and oral pathology, which I spoke to you. Then there is periodontist or periodontology for gum treatment. Root canal treatment, we have endodontist. Children dentistry, pediodontist or pediatric dentistry. Prosthodontist for replacement of missing teeth. Periodontist for gum related problems. And finally you have something known as a community dentist also, to take care of the needs of the general public, to have public health programs and health checkups, etc. So these are the various major branches. Of course there are other new branches emerging, like cosmetic dentistry itself is coming as a new branch, where cosmetic dentistry deals with teeth whitening. Aesthetic dentistry comes into a role, where the cosmetic dentistry along with other dentists also play an important role. They take care of the smile designing. They take care of the aesthetic part of the oral cavity. Again, another branch of dentistry is forensic dentistry, forensic odontology, as they generally call in a dental terminology. Is a part where the dentist plays an important role in checking the records and keeping the records of some patients. For example, a mass disaster and we have an air crash, you want to identify the victim, then the teeth are the only source where you can probably, it does not destroy in a mass disaster. So that teeth and any teeth related problem which has happened to that patient can be identified through a forensic odontologist or dentist. So this itself is another emerging branch in science and dentistry. From one dentist handling all the problems to multiple dentists in today's era to handle different branches of dentistry. That is the modern change and the good change about dentistry. So people related and health related problems and dental related problems are being treated by different specialities, and that is the world today, the futuristic approach towards dentistry.